strong argument as to why we should all vote no on the nomination of Robert F. Kennedy, Jr. to be Secretary of Health and Human Services. And I come to the floor tonight to voice my strong opposition to this nomination. You know, Mr. Kennedy says that he'll always follow the evidence, no matter where it leads. Well, if you look at his record, he hasn't done that. But, Madam President, let's apply that guidance and see where it leads when it comes to his own nomination. First, is he qualified to do the job? That should be the basic threshold question for any nominee to a position such as this. And the short answer is no. But let's now look at the evidence and understand why. We know that the Department of Health and Human Services manages some of our most critical health programs, like Medicare, like Medicaid. It does health research that delivers treatments and cures at the National Institutes of Health and the Advanced Research Projects Agency for Health. At the FDA, the Food and Drug Administration, it determines whether or not the drugs we consume are safe and whether they're efficacious, whether they will actually do what the manufacturers say they will do. At the CDC, the Centers for Disease Control, they disseminate information about pandemics and health risks, and they monitor the risk of outbreaks of disease around the world, especially those diseases that can travel across boundaries and hit the United States. It helps treat our nation's substance use crisis at the Substance Abuse and Mental Health Services, known as SAMHSA. It ensures patient safety in our healthcare systems at the Agency for Healthcare Research and Quality. And it runs life-saving programs like the community health centers, Healthy Start, and the HIV/AIDS care at the Health Resources and Services Administration. It does all that and more. HHS also provides quality control for reproductive health services. It ensures that contraceptions are covered under the Affordable Care Act, and it makes sure that Americans can have access to over-the-counter options. HHS, the Department of Health and Human Services, also includes early childhood development programs like Head Start and child care, programs to help the elderly age in their communities, and individuals with disabilities live independently. But, Madam President, when you look at that wide range of important subjects that HHS covers, Mr. Kennedy has no experience, no qualifications in the vast majority of that work. Now, I don't think any of us expect that one secretary of HHS can know everything. But if you monitored the hearings and listened to Mr. Kennedy's answers, you can see that Mr. Kennedy knows virtually nothing about all those important subjects. In fact, he was stunningly unprepared to discuss even the most basic programs at his confirmation hearing. Madam President, most of us, even those of us who are not on Medicare, have some understanding of the program. From our parents or grandparents, we have a sense of the basic components of Medicare. Medicare, of course, provides health care coverage to 68 million Americans, seniors and people with disabilities. But when Senator Hassan of New Hampshire questioned Mr. Kennedy about those basics, he pretty much got everything wrong. He could not explain the simple components of Medicare, like what covers hospital care and what covers doctor visits. These are not gotcha questions. These are not tough questions. These are questions that anybody who wants to be Secretary of HHS should understand, because Medicare is one of the biggest and most consequential programs within the jurisdiction of that department. knowing the basics, just the basics, should be easy. So he didn't understand the basics of Medicare. How about Medicaid? Medicaid is another very important health program in our country. It covers nearly 80 million of our fellow Americans, including 37 million children. In my state of Maryland, Medicaid covers 20% of our residents, children and families, nursing home residents, pregnant women, and people with disabilities. At his confirmation hearing, RFK Jr. complained about Medicaid's, quote, high premiums and high deductibles, unquote. Even though, as we know, the majority of enrollees in Medicaid don't have any premiums. Medicaid doesn't have high premiums, but what it does have is very high approval ratings. Mr. Kennedy also erroneously said that the federal government covers the full cost when we know that it has been a shared responsibility between the federal government and the states. In fact, that's been the matter of subject of lots of debates in the United States Congress and at the Supreme Court. He didn't know that. So what we see in RFK Jr. is a demonstration over and over and over again, even when our Republican colleagues on the Senate Committee for Health, Education, Labor, and Pensions tried to coach him along, he still simply did not get it, did not get the basics. Now, perhaps some of our Republican colleagues, some of them, don't care so much about his lack of understanding of Medicaid. I've seen a lot of reports in the last couple weeks that House Republicans are planning to make deep cuts to Medicaid as part of a plan to cut taxes for the very, very rich and ask other Americans to pay for them, including Americans on Medicaid. So maybe for some, the fact that Mr. Kennedy's ignorant about Medicaid just doesn't get in the way. You know, Madam President, we're debating a budget reconciliation bill here in the United States Senate. I serve on the Budget Committee. And today in the Budget Committee, I offered a very simple proposal. I said that as part of this budget reconciliation process, the Senate should not consider, in fact, they made it a point of order, subject to point of order if we did consider, should not consider cuts to Medicare or Medicaid. Simple amendment. Let's lay down some guardrails before we debate this reconciliation bill. Certainly not a single one of my Republican colleagues voted for that bill to make sure that we protect Medicare and Medicaid as we go through this reconciliation process. All of my Democratic colleagues voted for it. Now, it's bad enough that Mr. Kennedy is not qualified for this position. And clearly he's not qualified. But it's worse than that. I mean, there are lots of unqualified people that we might just pick out randomly and say, let's nominate that person to be the Secretary of Health and Human Services, and we could just have an unqualified person there. But with Mr. Kennedy, it's worse than that. He's not only unqualified, putting him in that position will put the public health of Americans at risk. And so that takes this to a whole different and more dangerous level. And we've heard a lot about this vaccine question, but it really does go to the heart of why he poses a threat to the public health. Now, he says he'll believe us on vaccines, quote, if you show me the science, unquote. Well, he should look at the science, and he should talk to the scientists in this country. Because in the past 50 years alone, vaccines have saved 154 million lives around the world, including the lives of 100 million infants. Vaccines eradicated polio and eradicated smallpox. They've prevented outbreaks of measles where they're used across the great majority of the population. They've kept recent generations from getting chickenpox. And yes, they helped lift the world out of the lockdown from the COVID-19 pandemic. So for generations, America and our federal health agencies have helped fuel this progress. More than 60 years ago, an American said, and I quote, "I hope that the renewed drive to provide vaccination for all Americans, and particularly those who are young, will have the wholehearted support of every parent in America," end of quote. Colleagues, that person was President John F. Kennedy. Unfortunately, his nephew, RFK Jr., has spent decades unraveling that hard-won legacy by spreading lies and conspiracy theories about vaccines. It wasn't that long ago that he spread vaccine conspiracy theories in Samoa, where his misinformation contributed to a measles outbreak that got 83 people killed, mostly infants and children. We cannot let that happen to children here or others around the world. But unfortunately, we're already seeing the costs of that misinformation and those conspiracy theories right here in America. Because that misinformation, the kind of misinformation spread by RFK Jr., has contributed to lower vaccination rates, and right now there is a measles outbreak in West Texas that's threatening our children. And it's not the first one we've seen in recent months, and it will not be the last if these conspiracy theories continue to spread. And we know that it doesn't take much misinformation to make us all vulnerable. Because if vaccinations rates drop below 95% in the cases of some diseases, those diseases can spread very rapidly through the population. In fact, for a disease like measles that infects just about everyone exposed, it's disastrous when those vaccination rates fall below 95%. And yet these lies spread by RFK Jr. are now burrowing themselves into the American consciousness like brainworms. And it will be bad enough if he doesn't become Secretary of HHS, given the damage he's already done. But if he becomes Secretary of HHS, he will have a bully pulpit on which those conspiracy theories can spread even further and even farther and put even more Americans at risk. Now, once he was confronted with some of these statements that he had made previously, RFK Jr. started to flip and he started to flop. In fact, at his confirmation hearings, he insisted that he never meant much of what he said, and in fact, he denied having made some statements altogether. He denied making statements that are on tape for everyone to hear them. As we've heard already, in 2013, he compared the CDC's childhood vaccine program to Nazi death camps, saying, and I quote, "To me, this is like Nazi death camps. What happened to these kids?" Unquote. In 2019, he compared the CDC vaccine program to the pedophile scandal in the Catholic Church. In 2023, he said that COVID-19 is targeted to attack Caucasians and Black people. The people who are immune are Ashkenazi Jews and Chinese, end quote. He denied saying that at the hearing. And this and that and flip and flop, he tried to backtrack a confirmation day conversion, nomination day conversion. He also, nevertheless, could not prevent himself, could not help himself from citing a discredited study on vaccines and autism, and repeatedly refused to tell the truth that peer-reviewed studies have shown that vaccines do not cause autism. Madam President, vaccines do not cause autism. So he's not qualified. Worse than that, he poses a danger to the public health, given his conspiracy theories about vaccines. But let's do what he says he does, and let's continue to follow the evidence. Because, Madam President, this nation conducts the best biomedical research in the world. A lot of it comes out of the National Institutes of Health, and I'm proud that they have their home in the state of Maryland. Just last year, the NIH research helped develop an accurate blood test for Alzheimer's, a brain-computer interface to help a man with ALS communicate, and a drug to reduce reactions to peanut allergies. All those things last year at NIH. NIH clinical trials give people hope with novel and hard-to-treat illnesses, including childhood cancer. And yet what we're witnessing in the first 22 days of this Trump administration is an attack on much of that medical research. Right now at the National Institutes of Health, the Trump administration is wreaking havoc. They've frozen internal meetings. They've pulled down information from data sets, from HHS websites. They've denied resources to the public and clinicians. Thankfully, a federal court had to step in and stop their refusal to provide the public with important health information at NIH and CDC. The administration also early on took this illegal action in violation of the Impoundment Control Act to stop a lot of federal grants that have already been appropriated. That also put in jeopardy a lot of NIH research. Again, fortunately, a federal court has intervened and issued a temporary restraining order. But just in the last 3 or 4 days, we had NIH decide to change entirely the formula for reimbursing institutions that study diseases around the country. And the overwhelming evidence and testimony from the experts said that by changing those formulas, they will do great damage to important health research in this country. Again, a federal judge had to intervene to stop this. We shouldn't have to rely on the courts, Madam President, in order to get the job done for the American people. We certainly aren't going to be able to rely on RFK Jr. were he to be confirmed. So he poses a threat to that important research that's going on at NIH. In fact, just this past November, he said, and I quote, "We need to act fast. 600 people are going to walk into offices at NIH and 600 people are going to leave," unquote. That's RFK Jr. back in November. And if he doesn't fire you, he still doesn't want to let you do your job. He's on record saying that his plan for NIH is, quote, "giving infectious disease a break for about 8 years," unquote. Madam President, infectious diseases have no plan to give us a break, and we should not be giving them a break. And I can say right now we're seeing avian flu outbreaks across the United States. I'm hearing a lot about it, of course, from my farmers on the eastern shore of Maryland, and it is contributing to a huge spike in the price of eggs around the country. And yet, as this headline indicates, the Trump administration's communication freeze restricted access to critical bird flu information. That's just one story about the effort to shut down information important to our health. And it is our health because if avian flu mutates, it's not just higher egg prices that we've seen. It could start jumping from person to person, and we could see another pandemic. So We should never give infectious diseases a break. They will never give us one. Finally, Madam President, I want to look at one last dimension of all of this, because Mr. Kennedy says to follow the evidence. The evidence shows he's unqualified. The evidence shows that he would actually be worse than unqualified. He would pose a risk to the public health of our country. So it does beg the question whether he believes all these lies and all this disinformation. Sometimes it's hard to tell, because he seems to believe whatever gets him a lot of money and a lot of attention. And here's the evidence for that. His cousin, Caroline Kennedy, told the Senate that he, quote, vaccinates his own children while building a following by hypocritically discouraging other parents from vaccinating theirs, unquote. So what's good for his family, he discourages other families from doing. During his time at the misnamed Children's Health Defense, which is an anti-vaccine lobbying organization, he'd made millions of dollars from anti-vax lawsuits. And at his hearings, when he was asked to forego any profits he might gain from those lawsuits, even as Secretary of Health and Human Services, at first he said he wouldn't, and then he said, okay, he won't take that profit for himself, he'll assign it to his son. He seems to flip and flop with the winds. When he was working to be a Democrat, he said he was ardently pro-choice. Now, he says he believes whatever Donald Trump believes. He wrote entire books about climate change, but now, with Donald Trump in the White House, he's willing to agree to disagree. So, Madam President, what the evidence shows is that he will not stand up for our public health. And we've seen this pattern, of course, with other nominees who get nominated for the positions not because of their qualifications, but because of the fact that they bow down to everything that Donald Trump says. We've seen that in nominee after nominee. And while, of course, the president wants people in his cabinet who are going to follow his guidance, we would also hope that these are people who are qualified and people who don't pose a danger to the country and people who are not just doing this to make money for themselves. And when it comes to that test, again, let's do what Mr. Kennedy says. Let's follow the evidence. Strike one, he's not qualified. Strike two, he's actually a danger to the public health. And number three, he says things, according to his own cousin, that we're not sure he believes because he doesn't apply the same standard to his own family. He says things to enrich himself even when it puts others at risk. So, Mr. President, I would say strike one, strike two, strike three. He's out applying his own test of following the evidence. Mr. Kennedy is simply not fit to be Secretary of the Department of Health and Human Services. I urge my colleagues to vote no, and I yield the floor.
Senator from Connecticut.
Thank you very much, Mr. President. I'm joining my colleagues on the floor today to raise